In this video, we will cover the care plan for risk for impaired skin integrity post-amputation. Before we start, check the description below for your free care plan worksheet. This will be useful for writing down rationales provided in this video. Now let's continue with the video. The purpose of a care plan is to document the patient's needs and wants, as well as the nursing interventions, or implementations, planned to meet these needs. As part of the patient's health record, the care plan is used to establish continuity of care. What are the reasons a patient may have risk for impaired skin integrity post-amputation? The reasons include the following: mechanical trauma such as surgical incision, mechanical factors such as poorly fitting prosthesis. What is our goal for the patient? The following are the goals. Patient's skin remains intact as evidenced by healing of incision, no redness over bony prominences, and a properly fitting prosthesis. Ongoing assessments. The ongoing assessments for risk for impaired skin integrity post-amputation are the following. Assess the wound for the following. Normal healing. The wound should be clean and dry, with edges of the incision approximated and intact. Patients with diabetes or with poor circulation, such as the elderly, may face considerable obstacles in healing, and the course of wound healing may be prolonged. Bleeding and hemorrhage. As with other surgical dressings, there should be no frank bleeding from the incisional site. A small amount of oozing from the incision is normal. Documenting drainage characteristics helps other caregivers assess status changes. Initially, most post-amputation dressings are pressure or pressure cast dressings. A surgical drain may be placed to remove fluid or blood that might interfere with granulation. Proper fit of post-surgical cast or pressure dressing. A rigid dressing or a cast may be applied to the residual limb immediately after the surgery and will remain in place for 7 to 10 days, until the sutures are removed. This type of dressing contributes to shaping of the residual limb for proper fitting of the prosthesis. After removal of the sutures, a new cast or rigid dressing may be applied. Occasionally, these casts are fitted with a basic prosthetic device that allows for early ambulation. Monitor the residual limb every hour for the first 24 hours, observe for symptoms indicative of infection. Signs of inflammation may be present. Edema, redness, pain, and tenderness should decrease over the first 3 to 5 postoperative days. Check the residual limb for signs of impaired circulation. Check the pulses above the amputation site. The residual limb should be warm and dry with no discoloration reflective of impaired circulation. Many patients experience circulatory compromise before the amputation. This problem may continue to represent a threat to the residual and unaffected limb. Preserving the health in the residual limb is of the utmost importance. The patient's adaptation to the prosthesis depends on having an adequate residual limb remaining for a good prosthetic fit and stability of the joints above the residual limb. Assess for prolonged pressure on the tissues associated with immobility. Non-blanching redness over areas of pressure is an early indicator of impaired skin integrity. Early ambulation will prevent the development of pressure ulcers and contractures from prolonged inactivity. During the early postoperative phase, the patient may have some weight-bearing limitations with ambulation. Monitor vital signs, including temperature, according to postoperative protocol. Tachycardia, tachypnea, and fever are early signs of infection. It is normal for the temperature and HR to be elevated in the first few days after surgery. Temperature should not exceed 38.3 degrees Celsius 101 degrees Fahrenheit, and the HR should not exceed 120 beats/min. Unusual pain in the residual limb may reflect the development of a postoperative infection. Therapeutic interventions. Now let's go over therapeutic actions of the nurse. Elevate the residual limb for the first 24 hours. Elevation of the residual limb for the first 24 hours reduces edema and promotes venous return. Prolonged elevation of the residual limb increases the risk for hip flexion contractures that may delay or interfere with rehabilitation and mobility. Reinforce or change the dressing as needed using a septic technique. Note any drainage. If a rigid dressing is not used, remove the bandage on the residual limb, cleanse the wound frequently, and reapply dressings using a smooth figure-8 wrap. Daily cleansing helps prevent infection. The proper application of elastic bandages using the figure-8 technique helps reduce edema and helps shape the residual limb. Instruct the patient on how to wrap the residual limb with compression bandages. Compression bandages aid in shaping the residual limb in preparation for prosthesis fitting. Wrapping the compression dressing around the waist seems to be essential in keeping the bandage firmly in place, and compressing the medial thigh encourages the residual limb to shrink in a fashion that will promote good interface with the prosthetic socket. Patients may need time to adjust to seeing their residual limb and may balk at assuming responsibility for its care until they are ready. Discuss weight-bearing limitations and their importance. These activity restrictions prevent skin breakdown and facilitate proper wound healing. The patient's limb may be non-weight-bearing for 4 to 6 weeks after surgery. Other patients will begin partial weight-bearing on the residual limb soon after the surgery. Factors that influence how soon weight-bearing takes place include the indications for the amputation, the level and the type of the amputation, and the repair and preparation of the residual limb. Teach the signs and symptoms of residual limb breakdown. Early detection of residual limb breakdown allows for prompt treatment. Slippage of the cast or rigid dressing may reflect underlying pathology such as infection or incomplete closure of the skin flap, which would interrupt healing. Complications may jeopardize the patient's rehabilitation plan and make further amputation necessary. That's it for this video. Check the description below for your free care plan worksheet. This will help you retain information for passing exams. Good luck with your future studies as a nurse.